Why does the uterus not always contract down or clamp down after birth? So just as a recap, postpartum hemorrhage is a blood loss of more than 500 mils after birth. We are designed to withstand quite a bit of blood loss as women because our blood volume increases during pregnancy so that we can have that big blood loss where the placenta is delivered. And what would naturally happen in most cases is that the uterus contracts down with oxytocin, so with own natural oxytocin, after that placenta is delivered. And basically what happens is as that uterus contracts down, it closes off all of the blood vessels where the placenta vessels have been going into the uterus, and it clamps it down and it stops it from bleeding. It's a bit like applying pressure internally. So by the uterus contracting down, it squishes all those blood vessels and it stops it from bleeding quite so much. Now, the rate of postpartum hemorrhage varies by the type of birth that you have, with caesarean births having the highest chance of having a postpartum hemorrhage because of the surgical loss, because you are going through all those layers and those blood vessels, for example. And it also varies by country as well. In a spontaneous vaginal birth with no instruments, there's no caesarean birth, no nothing like that, the average chance of having a postpartum hemorrhage ranges anywhere from about 4 in 100 births all the way up to about 8 in 100 births. A spontaneous vaginal birth and the uterus not clamping down is the one I'm going to focus on in this video. Uterus not contracting down after birth is only one of 4 reasons that high blood loss over 500 mils can happen after the baby is born. So let's start with the first thing. Why does the uterus sometimes not contract down? Well, sometimes it's because the woman is anxious, afraid, scared. Her third stage has been interrupted in some way, shape or form. If we have fear and anxiety, our adrenaline is produced. That blocks oxytocin. We need the oxytocin still to be able to contract and clamp down that uterus. Now, the uterus is a muscle. It requires energy to be able to function appropriately. And we know that women and people who have really long labours, so they've had a long first part of their labour, or they've had a long pushing stage, they become more tired, their contractions space out at the end of that first or second stage, and they don't ever pick up again because the mum is exhausted, she's tired, she needs that energy has gone basically. And you need that energy to appropriately contract and clamp down the uterus. So we know that women with prolonged long first and second stages of labour are more likely to feel tired, and their uterus gets tired, and so the contractions don't happen in the same way after birth, and that can stop the uterus from contracting down. It's also a very common reason to have a forceps or ventouse is that maternal exhaustion itself, and also because those contractions have spaced so far apart, and they are more likely to go on to have a postpartum hemorrhage after birth. Sepsis and infection are also really common reasons why the uterus does not contract down after birth. Our bodies are focusing on trying to fight the infection. So anybody who has had sepsis or infection during their labour and birth, even if they have a spontaneous vaginal birth with no instruments, no other things that have happened, that in itself can cause the uterus to stop contracting down after birth because your body is focused on fighting infection, trying to boost your immune system, and it's not sending the energy and everything that it needs to the uterus. Again, adrenaline is often produced in cortisol, which blocks oxytocin naturally within our body. The other thing to think about is induction of labour. So induction of labour increases the chance of having a postpartum hemorrhage. When we have synthetic oxytocin, so that's the hormone that goes into the hormone drip, it does not cross the blood-brain barrier in the same way. It can stop the oxytocin receptor sites on the uterus, so that's what our uterus responds to. It can stop it from working, particularly if you've been on a hormone drip for a particularly long time. Your uterine oxytocin receptor sites have basically become worn out, fatigued, they've had enough. And so prolonged oxytocin synthetically into your veins can increase the chance of postpartum hemorrhage from occurring. And it's all reasons why you might be recommended to have the injection for the placenta after birth, because either you're tired, you're exhausted, maybe the contractions, the tightenings have spaced out, maybe there's infection, for example. They can all be reasons why that uterus just doesn't clamp down in the same way postnatally. And it's why anyone who's being induced will be recommended to have the injection for their placenta, because when you produce that natural oxytocin after birth, your oxytocin receptor sites are not functioning as they should be because they're exhausted, they've been depleted by having lots of synthetic oxytocin through labour and birth. Then what can happen is your uterus is less likely to clamp down, and that's why you often need the injections for your placenta. Just a little note though, breastfeeding as soon as you can after birth, skin to skin contact, a golden third stage whereby we keep the rooms nice and dim, dark and quiet, can help to promote your own natural oxytocin in your body, which helps to contract down your uterus after birth, as can an empty bladder as well. Now, the final thing that can stop your uterus from contracting down is a full bladder, and that's because if you've got a full bladder here, what happens is your uterus is pushed up out the way and it can't contract down in the same way. So really important to wee throughout your entire labour, but particularly during that pushing stage. Lots of women will wee as they push anyway. That's quite a natural response to the baby coming down, is that as that baby is pushing through, there'll be just little trickles of wee coming out as that pushing happens. It's quite common. But after birth, one of the first things, if there's been sort of a gush of blood at all, will be to recommend you either sitting on a bedpan or a toilet if you feel well enough to be able to have a wee, or an in and out catheter will be quickly recommended to empty the bladder really rapidly. Once the bladder has decreased in size and the uterus can now have space to contract down, usually the blood loss stops at that stage.